Point, I mean, leaving aside that by civil service terms, that's quite a strong statement. What I'm really saying is that this is not laid out in a way which, in my view, was clear and would make ministers understand the choice they were making. And my worry was that this was a paper that was going to be put to the Prime Minister and Cabinet Ministers that implied, if you read it quickly, you'd think, oh, they're great, they're doing lots of things. And actually what they were intending to do was very much the plan that we had before the alpha wave began. And my concern was that ministers had to see in very stark terms what was it that they were agreeing to do. And my view was the way this was laid out, it was laid out in a way that made it very difficult for them, I think, to realise how little they were in fact doing compared to the previous plan.
All right. And if we look, I think, again at paragraph 18, which set out the approach relies on robust delivery of testing with maximal take-up by schools, on which we have significant concerns. Even with the extra week's delay in the return of secondary schools, it's an ambitious timetable. Department for Education has been commissioned for further advice, but key delivery challenges will include the competency and willingness of schools in setting up testing arrangements. We've heard evidence from Miss Ackland Hood that in fact the Department for Education was quite confident that schools would apply the testing regime, but in your view, would that have made any difference by that point? So in other words, even if there had been confidence in the plan and schools were ready and willing to implement it, would it have made a difference?
I mean, I absolutely could see the determination of schools to wish to open if they could, and for the Department of Education to make that possible. And so I didn't see any reason to doubt that they would achieve a good outcome in terms of mechanistically what they'd said they would do. The problem was that this was no longer sufficient for the extraordinary change in the risk that we now faced, based on starting with a very high level already and accelerating up at a very considerable rate at this point. And that's the point I'm trying to capture here, and what I suggested would happen is what happened.
Yes, and I think in the box there you're repeating the point again that you thought the worst outcome would be to let this play out and then have to pull the emergency chain.
I think almost certainly this is something that was attached to the email I sent, because the two look as if they're referring to one another.
So it's the same point again.
It's the same point, just put in a different way.
But in any event, that point was reached by the 4th of January, yes, and the emergency chain was pulled.
Unfortunately, yes.
And can I just ask you about that? Because Sir Gavin Williamson has given evidence before the inquiry about that decision. And I think there are a couple of points that he made that I think I need to put to you to ask for your epidemiological perspective on them. I suppose most important of all, he said that it was a decision, and I'm talking here about the decision to close schools to most children again. He said that he thought that it was wholly unnecessary. And he said that there had been exceptionally high rates of COVID-19 in northern towns and cities, yet it had been possible to keep schools in these areas open over this period, and that whilst it would be exceptionally challenging at a national level, he thought it was the right thing to do, as keeping children in school was so beneficial to them. So can I ask you about, from an epidemiological perspective, his opinion that closing schools was wholly unnecessary?
I mean, I think there are sort of two ways of answering that, and I obviously can't see into his mind and the way he's thinking, nor would I think that would be helpful to the inquiry. But what we had at the moment, objectively, was a very large number of people already in hospital and the numbers going up every day. So we were starting at a very high base in the middle of winter. Second point. Third point, where the R was now significantly above 1, not because anyone wasn't doing what they were supposed to, because by and large people were exceptionally good at trying to follow the recommendations that came from government, both professionally and personally, so it was absolutely not that. But it's just we had a really substantially, not slightly, but substantially more transmissible virus that had an R now that was potentially quite a bit above 1, and where we thought we could pull it down with non-school measures quite a lot of the way towards 1, but we were not at all confident to the point of thinking it's unlikely that we could put it all the way below 1 without closing schools. And so the choice, therefore, in front of the Prime Minister and ministers, from an epidemiological point of view, is, are you content in the middle of winter with this very high number for the R, in all probability, to be above 1, i.e. for this virus to carry on doubling for the foreseeable future? That was the epidemiological reality. And it was to that reality, given the very large numbers of deaths, that the Prime Minister and the Cabinet as a whole was responding. So I think, and you know, this is not a theoretical point, as I say, because as it showed, unfortunately, over the next 3 months, more people died in this wave, more people went into hospital in this wave than did in the first wave. But there was a final point, and I think that this is one that also I think sometimes gets lost, and I wasn't convinced that Sir Gavin picked it up in his evidence, so I'm going to make it now, which is, we now knew we had the vaccine and we were rolling it out, and we were confident that unless this new variant was very resistant to the vaccine, and we saw no particular reason why it should be, because it wasn't under any selection pressure, so I don't do it in ecological selection pressure. So there's no reason why it should be. We were confident that the mortality and severe disease from this disease would be falling away very rapidly by the time we got to about March, which would also be about the point when the NHS tends to be under less pressure, and then it would improve basically day on day from then on in. But we hadn't yet got to the point where all the most vulnerable people were vaccinated. You then had to wait 2 weeks for the effect to actually happen. So if we could just get through this next few weeks, then even if the rates remained high, the mortality rates, as indeed turned out, would fall right away. And from then on in, even if COVID continued to circulate, the risk of mortality would be very, very substantially reduced. Now, that was very different to the first wave. In the first wave, you can make the case that, OK, people won't get it this time and die this time, but there'll be another wave and they'll catch it that time. So in a sense, it's just delaying. Whereas in this wave, if you could just delay three months, then you could be in a situation where actually most of those people had almost no chance of dying at all and a very reduced chance of severe disease. Now, that was really, therefore, what the Prime Minister was faced with, was a very high risk and an exit strategy, which is an incredibly durable exit strategy based on vaccination. And the question was he prepared to let it to run and carry on going up? Because you can argue about exactly the numbers, but it is absolutely certain that the numbers would have been higher had the school closure not happened. And so then I think the political choice, the societal choice, the philosophical choice is, where do you put the emphasis between that substantially increased overall mortality and the substantial lifelong lasting effects of education not occurring for children and all the effects on mental health which have been laid out by other people? That's a perfectly legitimate choice, but to imply that there wasn't actually a very heavy cost to not acting, I think, is to misunderstand the problem from an epidemiological point of view.
I think one of the things he suggested was that school closures needed to be made, and I'm summarising his evidence, that this decision needed to be made in order to demonstrate to people how serious the situation was. In other words, it was to have an impact to make people stop doing whatever it was they were doing in order to reduce transmission. Is that accurate? Was there any part of it that was...
I never thought... So insofar as one reading, and this may not be what he meant, but I'm going to take it as one possibility. One reading of what Sir Gavin said was that the only reason for doing this was just for theatrical reasons, to prove to people this is a big problem. I don't think people needed any proof on that. They could see the numbers going to the NHS. It was day-to-day numbers were going up. So I think people were fully aware of that, nor was there any evidence that I could see that people were not doing their best to adhere to the regulations and the advice that was given. So certainly from my point of view, that would have been an unnecessary thing to do. And I didn't see anybody who was arguing that in any of the meetings I was in, that the only reason we were doing this was to make a point. I think people were absolutely seized with the view that stopping education for a further time was extremely damaging. I think that was universally agreed. So that, in a sense, to that extent, Sir Gavin's position and that of everyone else was 100% the same. And I think what most people were doing was saying we got a very difficult choice between two very difficult things. And that was obviously an extremely hard choice for the government to make. And you can argue whether it's the right one, but it was certainly made on the basis that this is likely to save lives that would not otherwise have been lost, because the vaccine will very soon be in a position where it'll essentially reduce very substantially the risk we face from here on in.
It may follow from everything you've said, Professor Whitty, but was the decision to close schools in January 2021 a more finely balanced one than the decision that had to be made in March 2020?
I think from an epidemiological point of view, I don't think it was finely balanced. I think it was, if the only thing you were trying to do was trying to prevent deaths, I think that the case in January was every bit as strong as it was in the initial closure in March 2020, and arguably because of this fact that the vaccine was just around the corner, in fact a stronger one from an epidemiological point of view. However, counter that, you already have children who have lost a lot of education. We have extremely clear evidence, not surprising evidence, but nevertheless very substantial evidence of not just educational harm, but mental health harm, many other harms as well from people being in school now. Difficult sometimes to tease those apart from being in lockdown and all the other strange things that were happening to childhood over this period, so I don't want to claim it's all schools. Nevertheless, that certainly was part of it. So the choices between those two terrible harms, and to that extent it is in a sense politically and societally balanced, but it was not. The epidemiological case was an extremely strong one in January, unfortunately.
And can I just ask you then, coming away from that second set of school closures, was there any clearer scientific consensus as to whether it was the closure of schools per se that reduced the R number in that period as opposed to the indirect effects? In other words, are we any clearer today as to whether it's schools or the behaviours around schools that reduce R?
Well, leaving aside the question about whether many of the behaviours, as you put it, around schools are just intrinsic to schools. So you can't, I think it's a fantasy to believe that you can have schools open and yet no parents meeting at gates and so on. And those kind of things just will happen. That's just a practical reality. But leaving that aside, the evidence wasn't massively clear at this stage. What did appear to be happening, and I think in retrospect, I think it's a bit less clear than it appeared at the time, actually, but certainly at the time that the decision was being taken by political leaders, it looked as if there was a much higher proportion of the transmission was among children than previously. And that, if you look at the epidemiological curves that were done in terms of testing people per age, what you can see is really the highest peaks very often were in children of school age.